The United Nations Children's Fund is appealing for $255 million to ramp up its emergency nutrition in response to the Eastern and Southern Africa region crisis. At least 1.5 million children are not receiving life-saving treatment due to severe depletion. The number represents nearly half of the estimated 3.6 million children. Christiane Rudert, who is the regional advisor for UNICEF, explains how these children lack life-saving treatment for severe wasting.
In the absence of conflicts or sudden onsets like in emergencies like floods, we always have some children who will fall into this acute state of malnutrition, which we call severe wasting. So many countries already have quite a large number of children who are suffering from severe wasting every year. Ethiopia, for example, each year expects to have around 1 million children who suffer from this most severe and life-threatening form. But the conflict, the drought, and other emergencies like floods make this infinitely worse. And of course, the COVID pandemic, which has had a huge economic impact on the lives of families and on their access to markets and food, has just made it worse. It has exacerbated an underlying situation that is already affecting these vulnerable children in many countries in the region. There are a number of factors, and poverty, of course, is one of the factors where families face, for example, food insecurity, they face illness, they face sometimes difficult access to reach services. But UNICEF has been working together with governments and many partners in these countries to try to expand the services to reach every child. This is both services to prevent malnutrition and services, for example, not only in the health system, but also services like social protection, services, water and sanitation, which is also essential to prevent malnutrition, and has really also expanded the network of community health workers who reach communities that are far from health facilities to screen children and to give them information about prevention, about the best ways to feed their children, to advise them about health services and so on. So more is being done. Services are being expanded. In 2021, we will reach around 1.5 million children with this life-saving treatment, and a lot more children are being reached. But then, as you've heard, there's still a huge gap, and more resources are needed, especially now with all the threats that are facing children. Social protection is gaining a lot of momentum in many of the countries. Ethiopia, for example, does have a social protection system, and it is being expanded. Kenya also has a growing social protection system, and many other countries are beginning to introduce this with support from many partners. And of course, the challenge, especially now in the context of the economic hit that many countries have faced as a result of the pandemic, the fiscal space is very challenging to find, to make sure that the transfers that families receive are adequate and that the coverage, the scale of the transfers also reaches all those in need. There's still much further to go, but we're very optimistic that the systems are being put in place and more children and families are being reached. Well, wasting is one of the acute forms of malnutrition. It happens quite quickly when a child faces a sudden event like a flood, where they're suddenly away. They've lost their homes, they don't have food. It may also take a little longer if there's drought and there's prolonged sort of depletion of the food security of families. And on top of that, if an illness like diarrhea or malaria takes place. The child with wasting is 9 times more likely to die. So that is the consequence if left untreated for many children. A child with severe wasting is 9 times more likely to die than a child who is well nourished. Other forms of malnutrition, which may often go together with severe wasting, which we also call stunting, is a longer, more chronic form of malnutrition, which has long-term impacts on growth, on development, on learning, and of course the potential of a child to earn a living. So all of these long-term effects are faced by many of the children in countries that have 30-40% rates of stunting that underlie these then acute threats that happen, like droughts and floods and the impacts of conflict. We are most concerned about the youngest children, those aged under 2. They are most vulnerable, and we even see very young infants that are affected, and they on top of having a concurrent illness or other complication, they are extremely vulnerable. So those are the children of most concern. We have a very small window of opportunity to prevent stunting, and that starts during the pregnancy, when the mother needs the best nutrition and health care and support that she can receive. And then the infant needs the best start in life with exclusive breastfeeding within the first hour of birth and up to 6 months. And from 6 months to 2 years, they need what we call complementary feeding, that is nutritious and healthy and nutrient dense. Things like eggs and milk and animal source foods and protein and lots of different types of vegetables. Otherwise, the child misses that window of opportunity. Once a child is stunted, by the age of 2, most of the stunting will have occurred, and it's very difficult to reverse. And a child will then suffer those deficits, both of growth and health, but also, as I said, learning and earning.